Hey guys, I'm going to put this clip at the beginning of each area of care video, which is going to follow. So if you've already seen this clip, then skip past it. I will put the time marker down below as to when this bit of me talking is over with. So I used RobsReview, robbiewolf.com, link is down below, to study for and pass with flying colors my CPNE, which is part of the Excelsior LPN to RN Bridge program. It's the clinical big bad scary test. And it is big bad and scary. But I made a video of each area of care because that's my study technique. I made the video so that I could press play and practice the area of care while the video was going on beside me on my computer. Now, because you have to purchase RobsReview program, I can't give out any information that is proprietary to him. So there will be times in this video where I will blur something, I might cut something out, and all that's going to be left is the motions that you would do when you're doing the area of care correctly without using his mnemonics. Now, his mnemonics are awesome, so I highly suggest that you go onto his website and you purchase the program. It will be worth it. You do not want to fly to wherever, spend thousands of dollars for the test itself, get your hopes and dreams up, and then fail and have to come back and tell your family that you failed. So it's worth putting a bit of money out there to pass it. So for all of his mnemonics and all of his tips and hints and great teachings, get his program. But what I'm going to be showing you now is how to do each area of care going through the motions. Now, there's a few videos which I made which I won't be able to put up here because I put the mnemonics across the screen for each thing, and so that is proprietary to him, so I will just not be able to show those videos. So if there's a few AOCs that are not posted here on my channel, then that's why. So what I do post up here, I hope that you enjoy it. I hope it's useful to you. And if you're absolutely dying to see an AOC performed that I don't end up posting, then send me a message and let me know. But there are other YouTube videos out there showing how to do different AOCs. So I won't make any promises that I will post any additional videos past the ones that I'm about to post, but if I get enough requests, then I might succumb. So enjoy the video. Okay, fluid management drainage. So the mnemonic is I'm going to wash my hands. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Knock on the door if I'm outside. If I were outside, I'd have to wash my hands after I got in. Hello, I'm Alita Rayner. I'm an Excelsior College student nurse, and this is my clinical examiner, Laura. And before I do anything, I'm going to go ahead and check your ID. Okay, I see that you're Susie Q, and your birthday, and I'm going to check my MAR, and yes, that's the same, and your birthday is January 1st of 1970. And yes, is the same, so that matches, so we're all good. I'm with you, the right person. And how would you like to be called? Susie? Okay. So I'm here today because I'm going to do a drainage management and assessment on you. So I want to thank you for letting me do this. I really appreciate it. I know you have a lot of people that are coming in and out of your room every day, so or during the day, and so I appreciate that you allow me to be one more person who's coming and seeing you. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. So I'm going to look up from your arm and da 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 da, and I'm going to pinch, and I'm going to look in your mouth. Okay, nice and pink and moist. But also with a baby, you have to check their fontanelle to see if it is sticking out or if it is sunk in or if it's flat. And then I'm going to look, and I'm going to see that you have an IV, and I'm going to wash my hands and gel up and get my gloves on and check for edema, and then take my gloves off and gel up again, and then look at the tubing and make sure there's no kinks and no air. And I'm going to look at the name of the machine and the rate, and I'm going to verbalize what those are, and I'm going to document what those are. So, and the IV was going to be the machine, the type, and the rate. Then I'm going to take my gloves off and gel up again, and I'm going to come down and see that there's a feeding tube, and then I'm going to keep looking down the leg, and it looks good, and then I'm going to do and look at the legs, and then I'm going to find out that there's no catheter, and then I'm going to keep going up and find out that there's nothing else here that I need to know about. So I see that you also have a JP drain, which is draining. So let me go ahead and get some gloves on and just check the skin around that JP drain. So I'm going to get alcohol. And gloves, and I'm just gonna check. So the skin looks really good. They're doing a great job here with you. There's no heat. I don't feel any heat, which is a good thing. It feels the same temperature as your other skin. I don't feel any swelling. It's nice and soft. And there's no redness or color changes. No drainage from the site. Make sure it's secure, that no tape is needed, that there's no kinking. So it's all looking good. Alright, was that tender when I touched around it? Little bit. Pain. 0 is no pain, and 10 is screaming and crying. A 1? Okay, that's good. Okay, so before I take off my gloves, I'm going to look at the JP bulb, and I see it's serosanguinous, which means that it's a combination of bloody and clear. So that looks good. That's what we expect. Okay, at this point, I'm going to measure out how much
is really small.
Is in the JP drain. So that that's going to be my beginning mark. So I'm going to just deflate your JP for a second so I can look at how much is in there. It looks like just 10 cc's. Okay, I'm going to put it back in. Alright, very good. Take my gloves off. So, how do you feel like that JP drain is working? You think it's working pretty well? Is it painful for you? Okay. And do you understand exactly what it's doing? So there's this thing called the teach-back method. Part of it is that after I tell you something, that you get to tell me what you learned from it, or repeat it back to me. So I'm going to explain to you why the JP drain needs to be there, and then afterwards I'm going to ask if you what you thought what you learned from it or what I said, okay? So the JP drain, swelling, do you understand what I said? Okay, very good. A+, very good. So here's the education on fluid management drainage. And then at the end, after I'm done with all my AOCs, I have to remember to go back, get my gloves back on, and look at it for output at the end of all of my AOCs. So that's a good reason to try to put fluid management first, because then it gives them some time to drink and pee and stuff and drain. That's the end of drainage. So all of that you have to document, and then I'm going to have to put a note in my grid that at the end of all my AOCs I need to go back and look at the amount of drainage at the end so I can say how much drainage happened over the course of my AOCs.